So welcome to the second appointment of the Impact for Beginners seminar series co-organized by the Center for Applied Sociology Research and the Gender Deviant Society Research Group. For the first seminar, we had Professor Claire Donovan discussing pathways to impact, and you can access actually the talk in the YouTube link that I put in the chat. Today, we are delighted to welcome Dr. Mary Cowan, whose talk is entitled Serving the Public Good and Delivering Impact Through Research. So Mary leads a research program in the Office for Statistics Regulation, and her talk today will address questions such as, for instance, how can statistics serve the public good, or what do we understand by public good? The seminar will be in total 1 hour long. Mary will speak for the first half an hour, and then we will have Q&A at the end. Feel free to use the chat if you have any questions, and I hope you enjoy the talk. So Julia, would you like to mention the working groups or anything else you would like to mention?
Yes, please. Thanks, Eleanor. It's such a pleasure to be part of organizing these events, and we hope these will be useful to anyone at Greenwich or elsewhere who's interested in impact. And we also we will record the session, so the session has been recorded for anybody who couldn't make it. We said last time that we wanted to create some internal working groups to work on different aspects of impact as kind of chosen and led by people within Greenwich. We still intend to do that very much. However, we thought that we'd use the seminar series as an opportunity to think through different aspects of impact a little bit more before we set up the working groups. So we aim to do that after the end of this term and during the summer term. So you will hear from us. Anybody who is kind of participating to these seminars and is interested will hear from us in due course. And yeah, I think that's all I have to say for now. Feel free to put kind of comments and questions in the chat as Mary speaks, and we will come to you in order. But because we've only got a sort of very relatively limited amount of time for the Q&A, please keep it to questions and not overly long comments so that we can actually make the most of out of Mary being here and talking to us. And yeah, that's it. Mary, please take it away. Thank you.
Thank you very much. I'm just going to share my screen now, so just bear with me 1 second. Okay, so yeah, thank you very much for that introduction. I'm Mary Cowan. I'm a research specialist at the Office for Statistics Regulation, and I'm going to talk about serving public good and delivering impact through research. I used to be an academic myself. I was a lecturer in psychology before I decided that I wanted to join the civil service. And when I was a lecturer, I had no idea what the Office for Statistics Regulation, or OSR, was. So I thought I would start off with just a little bit of an explainer, assuming that you might not have come across us before, about what the OSR is, what we do, and what the public good is. I then want to spend most of my time talking about a project that I carried out last year called Defining the Public Good in Applications to Access Public Data. So I'll tell you about that research project and then move on to talking about how that links to achieving impact and public good through research. And just as Elena said, there will be time at the end then for questions and discussion. So who are OSR? So we are the UK statistics regulator, and we're often referred to as the statistics watchdog. And when you look at watchdog, you get lots of pictures of scary dogs, but we're not scary at all. So I put a nice friendly picture of a dog there. In fact, we try to be very friendly as regulators and very approachable. That's a very, very important part of the way that we work. In terms of the structure of what OSR are, we are part of the UK Statistics Authority, and that's a government department. But it's very important to make clear that even though we are part of the civil service and we are part of the government, we are non-ministerial. So there is no Minister for Statistics kind of overseeing us. So we're very independent as a team. People often get us confused with the Office for National Statistics, which is ONS. We both fall under the UK Statistics Authority, but we are not the same thing as them. ONS produce statistics, we do not produce any statistics in OSR. So we are completely independent of statistics producers, and we really value that. That's a very, very important part of how we regulate. In terms of what we actually do in OSR, we have a vision that statistics will serve the public good, and you'll hear that phrase from us an awful lot. We believe it very strongly, and it's no exaggeration to say every single thing we do in OSR goes towards achieving this vision that statistics is going to have a positive impact on the public. Our mission is kind of three-part, so we do a lot. There's only 40 of us in the team, but we work really hard to do lots of different things. Our mission is to protect the role of statistics in public debate, which I'll talk a bit more about in a second. We also want to develop a better understanding of what the public good of statistics means. So that's my particular job that I'll tell you about as well. And lastly, our mission is to uphold the trustworthiness, quality, and value of statistics, which we know as TQV. To us, statistics of the highest standard will be very high in trustworthiness, quality, and value. So that means people can have confidence in the statistics. They can be assured that the data and methods were appropriate, and they can also find that statistics are valuable in the sense that they're relevant to people's lives. They actually help you to make useful decisions. And we believe those three pillars of statistics are incredibly important, and that's how we evaluate any statistics that we look at. In terms of the actual tools that we use and how we practically carry out our job, the main tool we use is the Code of Practice for Statistics. So it's all centered around the three pillars I described: trustworthiness, quality, and value. It's very short to read, and it's a great read if you fancy having a look at it. It's available on our website, and it just talks about how statistics can achieve the highest standards possible. And the other tools that we use are assessments and compliance checks. So that's where we look at one discrete set of statistics and we evaluate them against our code of practice. If we deem that they meet the code of practice, we can then give out our next tool, which is the National Statistics Designation. So if you've ever looked at official statistics, that is statistics which are produced by government departments, you might sometimes see this little circular badge of national statistic on them, and that means that they have been evaluated by us as reaching the highest standards of statistics. So we only give out the national statistics badge when something's very, very well done, when it's excellent, when we can't find fault, really. And so just to be clear, we regulate official statistics, so that is government produced statistics, but national statistic is a type of official statistic, but they are, the kind of gold standard work, really. So that's what we spend a lot of our time doing. We also have something called the systemic review. I'm involved in one of these at the moment. They're very fascinating pieces of work where we look at a topic area. So for instance, at the moment, I'm working on a systemic review of the statistics related to transport accessibility. And what we do is we look at that topic area and we ask ourselves, are the statistics in this area meeting the needs of users? And we then speak to lots of people. I think we spoke to nearly 50 different people in the course of this project. And we try to understand how the system can make improvements in order to make sure that the statistics are meeting users' needs. And the last type of tool we have is called Casework. And we spend a lot of time doing this, and this is where we make interventions when we identify the misuse of statistics. So if you've ever come across us, it's probably in this context. And this is where we tend to hit the headlines, as it were. So on the screen, I have just some examples where we've been referred to in the news. So here you see we're talked about as being the statistics watchdog an awful lot. That comes up. I think we don't mind that label. That makes perfect sense for people. But you can see when there's been any kind of identified misuse of statistics in the public eye, where official statistics have been misused, people will write to us. So anyone can do that. Anyone can complain to OSR. So if you see a politician saying something about official statistics and you think it doesn't sound right, we're the people that you speak to about that. You can send in an email to us and we will investigate and can then take action over whatever misuse we have identified. And so that takes up an awful lot of our time. That's how we protect statistics in public debate. But like I said, there's another part of our mission, and that is to better our understanding of what the public good of statistics really means. And that's where I come in. So I lead the research program in the Office for Statistics Regulation. And it's a really fascinating job. Our focus is to gather evidence and initiate research projects just to develop our understanding of what the public good of statistics is. You might not have come across this phrase before. It's something I think that we use an awful lot in the civil service, but don't tend to use it a huge amount generally. But just to give you an idea of what we're talking about, the legal definition of public good, which was written into law when OSR was created, refers to statistics which help the public to understand social and economic matters and which aid policy decisions. So it's a very straightforward thing just to say that these are statistics which will help the public understand more about the world they live in and help policymakers to make decisions. And so that's essentially what we're regulating. But in order to make sure that we're regulating properly, we think it's really important that we go beyond that simple legal definition and try to understand specifically what does statistics serving the public good actually look like. I think that very brief definition just isn't enough to tell us, practically speaking, what are we looking for and how do we know that we're regulating properly and that statistics are having the impact that we want to have. So just for the clarification around the language, we see public good as being the positive impact that we want to have and that we want statistics to have. So here I'm talking about impact as a longer term change, and I would see public good as being a positive type of impact. And that's exactly what we want to have. So for us in the research program, we think the more that we know about public good, the more that we can tell whether statistics are having the impact that we want them to have, whether they are genuinely helping people understand the world around them, and whether they're genuinely helping policymakers to make evidence-based decisions. So I hope that language is clear. Looking up, specifically what public good is relative to impact, there isn't literature on that. We are trying to define public good as well as we can, but that is our understanding, that there is this very big overlap between public good and impact, and this is how we would see it. So in the research program, I've been running it for 2 years now, and we have decided to take an approach that we want to understand what public good is from the perspective of different people or different things. The first thing I did on the research program was to carry out a literature review where we looked at the literature around public good, and that's published on our website if you'd be interested in reading it. We also have a very big focus on understanding what the public think about the public good. In the kind of statistics landscape that I'm a part of, we find that there tends to be a lot of focus on what policymakers think about public good, because they know how to make their voices heard in a way that the general public might not be able to make their voices heard. So we think it's very important to seek out the views of the general public to understand whether statistics are having the impact that we want them to have. So my real focus in the past year and the year coming up is to really spend lots of time talking to members of the public about what they want from statistics. I think that's really, really important. I'm also doing a project looking at what our own statistics regulators think about public good, to ensure that as a team we have a consistent and clear message that we're communicating. And the project I'm going to talk to you about now is looking at public good from the perspective of researchers, which is a piece of work that I did last year. So this piece of work was called Defining Public Good in Applications to Access Public Data, and it had the main aim of gaining insight into how the public good of statistics is conceptualized by researchers in order to further our understanding of what the public good really means. So that was our idea. Like I said, we know the public good definition we have is quite brief, it's short. We want to hear about how other people conceptualize it and think about it, and so we decided to talk to researchers about that. But we didn't talk to them directly. The source of this work was applications to 2 different mechanisms that you might have come across. The first is the Research Accreditation Panel, which is otherwise known as the RAP, and the National Statisticians Data Ethics Advisory Committee, otherwise known as the NSDEC. And these 2 things are routes by which researchers can gain access to public data for the purposes of research. And these applications are really, really helpful for us because it involves a section where researchers are asked to state precisely how their work is going to serve public good. So that's the part that I was interested in. So these are mechanisms. I've got links at the end of my slides that have information about what the NSDEC and the RAP are. The key thing to bear in mind about them is that they are very similar in what they achieve. They will allow a researcher to apply to say what data they want access to, and that could be any government held data at all, you name it. If the civil service hold it, you can apply to access it, and the panel or the committee will consider your application, and most of the time people are successful in getting access to the data that they want. So it's a fantastic method to share data and to link data, which is used by a lot of researchers. And when I say researchers, that can be anybody. It can be organizations, it can be newspapers, companies, universities, anyone in the civil service. It really can be anyone. And so they're really, really great mechanisms, like I said, for aiding the sharing and the linking of data. And the kind of main difference between them is the Research Accreditation Panel. That's the route that you take in order to accredit yourself as a researcher or your project in order to gain access to data, whereas the National Statisticians Data Ethics Advisory Committee is the ethical route that you take. So if you don't have access to an ethics committee that you can speak to, you would go the NSDEC route in order to gain access. So that's just the main difference between them. So like I said, what I wanted to do was to look at these applications and see how researchers talk about their work serving public good in order to develop an understanding of what they think about public good. The method that I used was quantitative and qualitative content analysis of these public good statements. I wanted to first quantify the types of applicants and the types of research that were being talked about just for the purposes of sampling. I then wanted to analyze the types of public good that were being referred to most often. In the applications for the RAP, researchers are given 7 different options to choose from in terms of types of public good. So I used that as kind of a framework to look at public good. And I also wanted to compare the differences between the NSDEC and the RAP applications. And one thing just to note at this point is that for some reason, the applications sometimes use the phrase public benefit instead of public good. Those terms are used very interchangeably within the civil service. I've noticed that people use these phrases as though they mean the same thing. I can't promise that they do mean the same thing. No one has ever asked anyone if they mean the same thing. This isn't written in a book somewhere. So I will use the phrase public benefit when it's used in the application, but I think it's very important that we carry out research. So that's something I'm doing at the moment in my own team, carrying out research to see, do we think public good and public benefit mean exactly the same thing? Of course, we'll take that question to members of the public as well. But just to be aware, the language moves around a bit, and it's just due to the nature of the applications. In terms of sampling, what I found was that when I looked at the different topics that come up in the applications, I could roughly break them down into 5 categories. So there were topics looking for data on business, children, environment, health, and population. So you can just see on your screen the spread of applications. When I looked at them, there had been 140 applications in total when I was doing the sampling work. So I just wanted to make sure that I was choosing from different categories in a very fair way, so that I wasn't, accidentally just looking at business or accidentally just looking at population. I wanted to make sure I was looking at each different kind of topic. I also wanted to make sure that I was hearing from different kinds of applicants. When I looked at all of the different applicants who had applied to the applied in the applications I was looking at, I find that they roughly fitted into 3 categories. So academia, government, or organization. So that could be a charity or a company. It was just not academia or the government. So like I said, fit into 3 categories, and I just wanted to make sure each time I had a selection from each box, so that I wasn't just accidentally looking at only government applications and then kind of narrowing the scope of what was there. So that was a sampling kind of framework that I had. In the end, I chose 30 applications based on this method to make sure that I had a good spread from all the different topics and the different types of applicants. And like I said previously, for the RAP applications, they contain a list of 7 different types of public good that researchers can use as a framework to decide which type of public good they're going to talk about in their application. These 7 types are taken from the Research Code of Practice and Accreditation Criteria. So you can certainly read more about that in that document if you want. Again, I've got a link to it at the end of my slides. But this is just to give you some insight into what the law was saying about public good in 2017 when the Research Code of Practice and Accreditation Criteria was published. This talks about public good in a broader way than the previous definition I gave you. It does focus a lot on policy making. I think the first three categories, directly and indirectly, could be said to relate to policy making. They involve creating an evidence base for public service delivery, policy decision making, and making decisions which will benefit life in the UK. The next three are quite closely related as well. So they involve replicating, validating, or challenging official statistics, existing research, or improving the quality and coverage or presentation of existing statistical information. So kind of furthering what we know about research and statistics for the benefit of people. And the last category, it involves helping to extend the understanding of the general public. So that's extending their understanding of social and economic trends. And so for those 7 categories, what I was essentially doing in the applications was looking to see which one had been filled in the most, which one had been mentioned the most, to try to gain an understanding of, from a researcher's perspective, which type of public good their work is going to serve the most. So I hope that's clear. If it's not, I could certainly clear it up later in the questions, but that's essentially, these are the 7 things I was looking for. And I was going through the applications, looking at how many of them mentioned each of these 7 topics. On the right-hand side, I just have some abbreviated terms that I used in order to make my graph look a little bit nicer. That was all. So here you can see some of the findings that I had from the quantitative look at the data that I did. This isn't inferential because I had a very small sample, obviously, so this was just looking at any kind of trends or patterns in the data. And what you can see here is that for policy decisions, the point at the top, for the RAP applications, which are primarily coming from academics because they don't need to follow the ethical route, they already have access to ethics committees. 100% of applications to the RAP mentioned policy decisions. So right off the bat, this was telling me that academics were really prioritizing policy decision making when it came to talking about public good in their work. On the other side of the spectrum, we can see that for the RAP applications, improved statistics and further official statistics were not very common categories, so very few applications mentioned those. So that demonstrated that, you know, this was obviously something that wasn't as much of a priority to those people who were applying from the RAP. In terms of the NSDEC, I did see some differences. So if I go to the next slide, we can see that illustrated in a table. You can see the differences between the NSDEC and the RAP a little bit more clearly here. For the NSDEC, it was very clear that service delivery was the most important thing, along with improved statistics. And so that might be expected because most of the applications for the NSDEC come from civil servants. So perhaps their expectation is that improving statistics is one of the most important things that they can achieve through their work in terms of public good and the impact that they're hoping to have. One thing I found really interesting was the fact that extend understanding wasn't very prevalent in the applications. So you can see for the NSDEC, 61% of applications mentioned extending the public's understanding of social and economic matters, but just 25% of RAP applications mentioned this. And I think it surprised me because when I was reading the applications, it was very clear to me that every single one of them would have easily extended the understanding of the public. It didn't have to change or do anything else in order to extend the public's understanding of something. And so I was surprised that that wasn't prioritized by researchers and primarily academics, because that was something that their work did. It almost made me wonder if they weren't valuing that aspect of their work as much as they perhaps could have. Which isn't a criticism, it was just an observation that I had as I was reading the applications. And so it is very clear from looking at them that the NSDEC and the RAP, people are writing about quite different things when it comes to public good. And it was clear overall that there was quite a focus on policy, even in the NSDEC, which was primarily from civil servants. So that was the quantitative kind of trends that I looked at. In terms of qualitative insights, I wanted to also look and see if there were any other points brought up which didn't fall into the 7 categories which I mentioned. And one thing I noticed was that public spending was mentioned an awful lot. Nearly half of the applications talked about public spending, and you could perhaps argue that it falls into one of the previous categories, but it was talked about so extensively that to me it really felt like it warranted its own kind of category, that it was something that was obviously very important and admirable that people are making this argument in their work that this is something that they think that they are going to be able to do with their research. They're going to be able to improve the way that public spending happens, or the way that decisions are being made. I also noted that providing regional information was very commonly mentioned as well. And so I think that really highlighted the importance of granularity for researchers. And I think certainly in the work that I'm doing and the people I'm talking to, it feels like the spotlight is really going on regional information at the moment, that people are recognizing just how important it is to have that granularity to be able to improve decision making. And lastly, I also saw that quite a few researchers talked about how research collaboration was being described as a public good, and I thought that was really, really fascinating. So I have one quotation here that I took from one of the NSDEC applications, and I thought this was a lovely quote. They wrote, "At a strategic level, this piece of work is also symbolic of how far producers have come in working collaboratively. One of the key criticisms was that producers worked in silos, focused on producing statistics that were key to their own policy priorities while ignoring the general public good." And when I read this quote, I thought, wow, this person really gets it. They understand the process that the NSDEC and the RAP have created, and that linking and sharing data is a really, really key part of serving public good, because you are feeding back into that evidence base that policymakers can use and the public can use. And I just thought this was a really lovely quote to kind of summarize one of the real public benefits to the work. So one of the outcomes I just wanted to draw your attention to after I carried out this piece of work, I published it. It's available on our website, and I presented it to the NSDEC members to kind of talk to them about what they thought of the findings. And I had a really interesting discussion with them, because my findings that there were some biases towards talking about policy more than other topics, I think that made them wonder whether there's something being communicated along the way that means people who apply to the NSDEC and the RAP are more focused on policy. So I think it really made them wonder about how they're communicating what public good is, when the committee told me, all these types of public good, those 7 types of public good, are all equally valid. If you submitted an application to the NSDEC and said all you were going to do was extend the understanding of the public, that would be enough to gain access to the data. You don't need to show that you're going to change, policy or public service delivery or anything like that. So I think that really made them think about what they're communicating in terms of prioritising policy. And it led to the Centre for Applied Data Ethics within UKSA developing guidance for researchers to consider public good in research and statistics. So again, I've got a link to that at the end if that's something you might like to look at. But I think for me, that's a really positive outcome of the work, because it really helped to identify that researchers were a bit unsure perhaps about public good, and that having something which will explain to them a little bit more about how their work can serve public good would be a valuable resource. So I think one of the points I really want to make is that I think it's really important to recognise that research can achieve impact beyond policy. Policy is not the only way to help people and to feel that your work is having impact. I think contributing towards public knowledge, developing statistics and furthering research are all really, really key ways that can happen. One case study that I just wanted to bring to your attention, if you've not come across this already, was from Nadia Butler, who works at the Public Health Institute in Liverpool, John Moores University. Nadia won the ONS Research Excellent People's Choice Award. So these are awards that are given out by ONS at a research capability conference, which takes place every year. And Nadia presented findings from So the example that I wanted to give was that Nadia presented findings from her work, Cycles of Violence in England and Wales, the contribution of childhood abuse to risk of violence re-victimisation in adulthood, to the City Safe Board, which was made of the mayor, councillors and many local groups, including police and members of the general public. So the point I'm trying to make here is that Nadia Butler carried out this very interesting work about the re-victimisation of people who were victims in childhood and go on to become victims in adulthood. And this work was so fascinating, and she decided in order to have impact and for this work to reach the people that it needed to reach, she would take it directly to people. So she has presented multiple times to this City Safe Board in order to make sure that this information is actually reaching the people that it needs to reach. And I think this is a really interesting way for work to have impact. And I think, you know, she did so well. She won this award, which was People's Choice Award. It was voted for by members of the public, and I thought that just shows you the impact that this has had. That people they know something that they didn't previously know, and they know something very, very valuable that could really help to change people's lives. So I thought this was a really great example of someone kind of going out of their way to try to extend the public's understanding of something, which didn't relate necessarily to policy, but will really, you know, potentially help to change people's lives. Some other points that I just wanted to come back to regarding how to achieve impact through research. So these are points which came up in the course of all of the kind of the conversations that I had in relation to my research, in all of the presentations that I've given and the conferences I've been at. A few different things have come up, which I think are kind of lessons learned for me about impact through research. I think one of the messages I would really communicate after this is that research, which is produced through qualitative and quantitative methods, can be very, very impactful and tell a really well-rounded story. This is something I would say for everyone to really consider the methodology that you're using when it comes to achieving impact, because I think...
Yes.
Oh, sorry, was someone talking to me? No. I'll keep going. So I think this is something that I've heard from...
No.
Oh.
Sorry, I think somebody is accidentally... All good, all good.
I wasn't sure if someone was telling me no, they don't agree. That's fine if they don't agree. But yeah, so sorry, just yeah, back on track. One of the points I've heard this from lots of people. I think it's a really important point to take on board is that when you want to have impact in your work, trying to mix qualitative and quantitative methods is a really, really good way of doing that. I've heard this from researchers. And I've heard it from people who speak directly with policymakers, and I've heard it directly from policy decision makers myself in the context of my own work in regulation. In speaking to policymakers, I think there is this feeling now that having just quantitative methods or just qualitative methods to rely on in terms of making an evidence-based decision feels like you're not getting a full picture. And so what I'm really hearing now is that there is this drive to combine both methods so that you can see whether something is, you know, a prolific issue. Perhaps you've got your quantitative methods to show you, you know, in a sample, is there a problem? What is the matter? What's the point that you're trying to make? But qualitative to give you a feeling of how people actually feel about something, to give you insight into the emotions that are going on and how much something is affecting people. So I would say if you're thinking about, you know, how your work might be able to achieve more impact, really consider the methodology that you're using very carefully and try not to just you know, think about it in a narrow way. Try to think about whether you could combine other methodologies in order to tell a more well-rounded story, because this is exactly what I'm seeing now, is that the most impactful stories that I'm hearing are a mixture of qualitative and quantitative. So I would really strongly encourage that. And it might be that you have a preference for one or the other. I think when I was an academic, I definitely had a preference for one over the other. But I think this is where collaboration is so important. If you collaborate with other people who have a different level of expertise or a completely different methodology that they are very expert in, that's a really strong way of combining with someone else to tell a more impactful story. So I'd really strongly encourage that kind of collaboration, because I think that really is in the interests of impact and public good. I would also encourage people who are thinking about impact to consider the kind of public engagement they're doing. So you saw the example I gave of Nadia Butler's work and how she engaged with the public directly going to speak to the City Safe board. And I think that's a really, really valuable thing to do. I've heard people do similar things, going to medical centres to give talks to women who are breastfeeding, for example. There's lots of different things that you can potentially do. In the pandemic world, that kind of thing is not so straightforward anymore. So you could also consider how you're engaging with intermediaries. What we know is that a lot of members of the general public will never really directly access research or statistics themselves. They will access them through intermediaries instead. So I mean kind of newspapers or social media or anything that kind of go-betweens, that kind of thing. And so I'd say really carefully consider how you're communicating the information about your research through intermediaries. And if you might not have come across them before, the Science Media Centre are a fantastic organisation which they offer training to academics who want to communicate better with the media. They work kind of hand in hand with academics, trying to make sure that they have good kind of media training and that they know how to clearly communicate what they're doing to members of the public. So I would say, yeah, when you're thinking about impact, think really carefully about how you are engaging with the public, but also engaging with intermediaries. And if you need training in that way, I think that could be, very helpful. And another point that came up in my research was how important it is to embed your ideas from impact right from the very start of the project. And when I spoke to people who evaluated. Sorry, can you hear me?
Yes, you're back now.
Sorry, I just dipped out for a second there.
Mary?
Oh, can you hear me now?
Yes, we can
Oh,
hear you.
excellent. Sorry, that's just typical, isn't it? I'm right at the end, so not much longer to go. So comes a bit of an afterthought. It's very clear to people who are evaluating research that that is the case. So I would say make sure that your ideas for impact are being embedded right from the very, very start of the project, because it's clear when impact becomes a bit of an afterthought. Impact should be there right from the very start, embedded in every single thing you do. And I think that would be, a very wise thing to think about when you're considering how you can achieve impact through your research. And so those are the resources that I've thought might be useful for you to look at, and thank you very much for listening.
Thank you so much. That was fascinating. Yes, absolutely great. And in fact, it was great to have that little bit of advice at the end. And indeed, embedding impact right from the start is definitely something that we've heard from our previous speaker as well. Just completely fascinating. Thank you so much. And whilst we wait for questions, can I have the first question, please? Thank you. So why do you think there is such an obsession with policy and policy change, or anyway, kind of, why do you think that's the first taught, particularly for academics? Where do you think that comes from?
So I kind of have two thoughts on this. When I've presented this work previously, people have told me that they think that academics are kind of obsessed with policy because of the ref, and they think that the ref pushes people towards thinking about policy. And so I think that would be my first kind of explanation, because it's something that's kind of been fed back to me that I think my connection's gone a bit dodgy right now. I think it's also a little bit easier to quantify a change to policy, because you can see before and after. You can speak directly to people who are actually going to change policy based on what you have told them, based on the evidence you've supplied. And so I think that makes it a bit more seductive, that you want to be able to follow paths for impact that you can quantify. It's that bit harder to say how you have directly changed someone's life. And I think that's, it's very, very understandable that that might be the path that you want to take. But I think, my kind of war cry is always, don't forget about everyone else, because I think the public really do value evidence. I mean, even though they may not directly interact with research and statistics, there is a lot of strong evidence that the public highly value them. They value that the research is being done. They value the statistics. And so trying to, speak through intermediaries, trying to have that impact would be, a valuable thing to do, even if it's not quite as, catchy as policy.
Absolutely, yeah. The ref was my first thought as well. I think we got a comment or a question from Andrea. Could it be relevant as well in the context of funding? I'm not really sure what it means, maybe.
Yeah. Well, as I assume as an explanation for focusing on policy instead, I can absolutely see that. I think when it comes to funding, being able to talk about policy, I think the principle is probably quite similar to applying to access data as it is to applying to access funding. That's kind of what I would imagine as well. It would be a shame, and I would be very interested to understand whether funders or organizations that fund research mean for that to come across. I think with the NSDEC, they thought that they were kind of accidentally communicating the fact that policy was more important, but they didn't mean to. And so I would be very interested to understand if funders had the same attitude that, policy isn't perhaps the most important, it's just a bit easier to measure. But yeah, that's a really good point. It might relate to funding.
Thank you. Tracy.
Hi, Mary. Thank you very much for your presentation. It was great. I wanted to ask you about this difference between quantity of impact and quality of impact. And I guess, where do you see the balance? And do you think the funders have got it right? Because even when you talk about quantitative, and I agree, I think, quantity and qual makes a well-rounded sort of impact. But I was just thinking, is it more about demonstrating that you've impacted lots of people, or is it more, or could you just impact one person, but that impact, I mean, that's the extreme end, isn't it? It could be amazing, life-changing change. And so where is the balance?
Oh, that is a fantastic question, Tracy. So I don't have a very prepared answer for that at all, but it's definitely going to be something I keep thinking about. I think to us in OSR, you're right that there's probably a balance to strike, because we talk about public to mean the general public. So in an ideal world, your impact will be felt by everybody, and we would love for that to happen. But realistically, that's not going to happen. At the same time, we have a real focus on granularity, because we think it's really important that people can see themselves in statistics and data, so that it isn't just general populations described. We want more granularity, and we want more regionality, so that people in different regions feel they are represented in data. So I think it's such a great point. To me, I think I would focus more on quality rather than quantity, but that's a personal answer. I don't know what the OSR answer would be for that, because I think we want everything. We kind of want to have our cake and eat it, so that we have quality and we have quantity. But I think in an ideal world, I think quality would be more important to me, because that's what you're trying to impact people's lives. It may not be every single person, but every single person may not need you to impact on their lives. Some people will need it more than others. So yeah, all I can do is speak from a personal perspective there, but that's a brilliant question. So I'm going to think about that quite a lot.
Thank you. Thank you, Tracy. Does anybody have any questions, or please feel free to put them on chat, or you can come on the mic. We don't bite. Oh, Elena.
I have a question, and I don't know if you said that before, but maybe I just misunderstood this. But from what I understood, your Office for Statistics Regulation basically doesn't produce statistics themselves, and I wonder then what is the golden standard for the type of statistics that you actually recognize as, have the type of statistical value that then all these third sectors and academics can access. So what is your assessment type of approach?
So that is a good question. I think, to me, the Code of Practice for Statistics lays out exactly what our kind of gold standard is. And one thing that I didn't talk about in my presentation was that we have this, Code of Practice for Statistics, which outlines how your work can be high in trustworthiness, quality, and value. So I wouldn't call it a step-by-step guide, but it basically it outlines exactly what we would expect when we look at a set of statistics in terms of, you know, are they relevant? Are they trusted? Are they using quality assurance? Are they using the right methods? So we cover a very, very comprehensive look at these statistics. We look at all kinds of things. You even include staff training. You know, are you training your staff? But one thing that you can do, that we offer, is what we call VA, which is voluntary application. So anyone who isn't an official statistics producer, so if you're outside the government, an organisation can decide to adopt the code of practice for statistics themselves, and we will help to guide them to do that. So there's different organisations, such as TfL. They don't produce official statistics, but they've signed up to our code to try and bring their statistics kind of up to the level that we would expect them to be at, because, you know, the code of practice isn't just about official statistics, it applies to any statistics. So yeah, I'd really strongly encourage anyone who works on statistics themselves to look at that and see if there's any better practices they might be able to adopt, or anything they could do to kind of bring their statistics up to a higher standard for the public good.
Thank you. So you don't use like private organizations such as Ipsos Mori. They are all governmental statistics that are internal to your organization. Is that right?
That's right. Yeah. I mean, what some government departments can do is pay someone like Ipsos Mori to carry out research on the ground, and then they'll get the data, and then they put it into a format they want to publish. So that means they own it from that point on. But we would expect them to oversee that process in line with the code.
And methodologically, is the government's decision as to what questions are asked.
Exactly. Yeah.
Right.
Yeah.
Okay.
Precisely.
That's really interesting.
Great. I'll just put the code, link to the code in the chat for anybody who's interested. Do we have any other questions or comments? I said no comments earlier, but I guess we've got time. So. Well, I'll go with another one if nobody else will. So I'm guessing, like, sort of going back to the advice that you'd give academics in terms of how to engage with like impact and the public good. I'm wondering whether, you know, there's a sense sometimes that a lot of responsibility is placed on academics to do everything, to do everything well beyond what the role is of an academic is. So obviously you have to embed impact from the start of the project. You have to communicate with the media. You have to engage the public. You have to engage, you know, different kinds of forum or fora rather. And so, you know, it feels like it's a lot. The expectation is so much, and obviously we're not trained. You know, we're trained to teach and research. We're not trained to do a lot of these things. So I'm wondering, you know, what advice do you have, you know, in terms of trying to, you know, I thought the advice about media training and that sort of stuff is really good. But do you have any advice for us in terms of, you know, what maybe we should just focus on one type of engagement or one type of impact rather than trying to be good at doing it? Well, I don't know. Sometimes I feel like I'm a bit overwhelmed, basically, is what I'm saying.
Oh, I completely understand where you're coming from. Having been an academic myself, I really get that feeling that, you know, you kind of have to wear a lot of hats, and it's not that easy, and there's only so many hours in a day. I would say my kind of advice in that scenario would be to try and collaborate as much as you possibly can, but collaborate with people that you might not normally come across, or maybe think about the kinds of conferences that you're going to. I know as an academic, I tended to go to conferences that had other academics, and so it's lovely to make those kind of connections across different universities, and lots of valuable work can come out of that. But you're still kind of in an echo chamber when you do that. I think maybe think about the kind of conferences you're going to where maybe members of the civil service are going to be there, or charities, companies, third parties. Like there could be other people that you could collaborate with that could bring funding, that could bring expertise and time that you may not have. I mean, in the civil service, that in the team that I'm in, there's a huge focus on our well-being, and you know, we aren't, you know, pressured in the same way that other people in different professions might be. We have time to take on projects, and we've got lots of expertise within our own team. So I would say try and think really carefully about who you're collaborating with, and yeah, try and work with someone you wouldn't normally work with, and they may be able to help you kind of bring your own expertise that you have, but not stretch yourself too thin. And I appreciate that's way easier said than done. But just looking for, you know, different kinds of conferences or reaching out to people like OSR. I mean, we talk to academics all the time in OSR, and just to have interesting chats about things, to see if there's places that we could go together, if we could carry out research together, whatever that might look like. So do consider just reaching out to people who you think, you know, might be interested.
That is really excellent advice, actually. Conferences are a big thing, because obviously, but the echo chamber is a real problem. And then, of course, at Greenwich at the moment, we have a new strategy that focuses on knowledge partnerships. And so I'm sure the university would be very encouraging of us, you know, creating those connections and collaborations beyond the realm of academia. Oh, we've got another question from Jessica. This is what I wanted to ask as an ECR. Sometimes I'm not sure where to start and it can feel overwhelming. Yeah, so it's, yes, absolutely, Jess. It's like, it's yeah, I think, yeah, the knowledge partnership thing. I mean, obviously the collaborations entail their own kind of work. You know, it's a lot of kind of like coordination and sort of, you know, writing and administering across different two more organizations. But at the same time, it would be great to be able to also say, like, you know, I'm an academic, like there is a limit to what I can do. There is a limit to, you know, really real boundaries to my expertise. And there are people in third sector organizations in the civil service that are just better at doing other things. And so they should take the lead on that sort of stuff. And yeah. Anyways, so I think we could probably come to an end, because nobody else is saying anything. So.
There's no more questions. Yes, should we just close it here then?
Yeah, I think so.
So yeah, well, thank you very much for attending, everyone. I would like to just remind you that in February there's going to be our next seminar by Rob Davies, who is the leader of CLOSA, specialist in longitudinal research, and he also has really helpful tips on how to achieve impact. So yeah, stay tuned and enjoy your afternoon. Thank you so much for thank you, Mary, for this great talk. Thank you.
Thank you. Bye.
Bye.